Highlights of this topic include, for example, 2 studies that identify antigens that are recognized by the lymphocytes. On the one hand, these are tumor cancer-tested antigens. On the other side, these are neoepitopes. And it's interesting to see that a large fraction of patients with hepatocellular carcinoma is responding to these antigens. So this will give us a better understanding of the mechanisms how T cells successfully or unsuccessfully fight against the cancer. Also, we will hear about a new subset of tissue-like resident cells that are exhausted, that are into the tumor, highly express exhaustion markers such as PD-1, but also predict responsiveness to immune therapy. And since we're just facing a new phase in treatment of HCC, since a recent landmark study really showing that immunotherapy is successful in HCC, I think these studies, all of these studies in this session are of a very high clinical, but also scientific relevance. I think this session is of interest to almost all delegates. For scientists, basic scientists, immunologists who want to learn more about immunity against the most often liver cancer. Of course, for clinicians, we're now using immunotherapy much more with their patients and who want to learn more about the mechanisms behind it. And maybe even for patient organization, learning more about this new wave of therapy we're starting in liver cancer at this point. Yes, it indeed does. We have learned a lot about immunotherapy. We've learned about first immune therapy trials in HCC. But at this meeting, we're learning more about the underlying mechanisms. We're learning more about the antigens that are targeted by T cells. So I think it is a direct link to previous meetings, but really showing also the success and the progress we're making in this area. So we're looking forward very much to seeing you at this session. I think it really underlines the big progress we've made in recent years, learning about tumor antigens, learning about immunity, and I hope you will find this session interesting, maybe for your scientific, but also for your clinical work.